This medication is used to treat certain eye conditions caused by inflammation or injury. Prednisolone works by relieving symptoms such as swelling, redness, and itching. It belongs to a class of drugs known as corticosteroids. It is important to use this medication as directed by your doctor. The usual dosage is 1 to 2 drops in the affected eyes 2 to 4 times a day. The best time to take this medication is usually in the morning and/or before bedtime. Be sure to follow your doctor's instructions carefully. When using prednisolone acetate suspension, drops, it's important to follow some important steps. If your doctor allows you to wear contact lenses while using this medication, make sure to remove them before applying the eye drops. Wait at least 15 minutes after each dose before wearing your lenses again. To apply the eye drops, wash your hands first and shake the bottle well if it's a suspension form. Tilt your head back and look upward, then pull down your lower eyelid to create a pouch. Hold the dropper over your eye and place 1 drop into the pouch. Close your eyes for 1 to 2 minutes and apply gentle pressure at the corner of your eye to prevent the medication from draining out. Use the medication regularly at the same time each day to get the most benefit from it. The dosage and length of treatment will be based on your medical condition and response to treatment. Do not use this medication more often or for longer than prescribed, as it may increase your risk of side effects. It's also important to not use the product if it becomes contaminated, as this can cause serious damage to the eye. If your condition does not improve after 2 days or worsens, make sure to contact your doctor. Sometimes, you may feel a stinging or burning sensation in your eyes for a short period after using this medication. If this feeling persists or worsens, it's important to let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, prolonged use or high doses of this medication can lead to serious eye problems, such as increased pressure in the eyes and cataracts. If you experience any vision problems or eye pain, it's essential to notify your doctor immediately. Additionally, this medication may hide the signs of an eye infection and increase your risk of developing one, especially with long-term use. If you notice any new or worsening symptoms, such as eye discharge, swelling, redness, or vision problems, it's important to report them to your doctor. They may need to adjust your treatment. If you experience any serious side effects, such as headaches or dizziness, it's important to inform your doctor right away. While rare, a severe allergic reaction to this medication is possible. Seek medical help immediately if you notice symptoms such as a rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. Before using prednisolone, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. Also, be sure to let them know about your medical history, especially if you have had any recent eye infections, surgery, or eye conditions such as cataracts, glaucoma, or diabetes. After using this medication, your vision may become temporarily blurred or unstable, so it's important to avoid activities that require clear vision, such as driving or using machinery, until your vision has stabilized. If you are planning to have surgery, it's important to inform your doctor about all the medications, including prescription and non-prescription drugs, that you are currently using. For pregnant women, it's important to discuss with your doctor the risks and benefits of using this medication during pregnancy. Similarly, if you are breastfeeding, consult your doctor before using prednisolone. It's important to be aware that prednisolone acetate suspension, drops, final dose form, may interact with other medications, which could affect how well your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. You should never start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safety and effectiveness of your treatment. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control centre. It is important to take the medication as directed and not to exceed the recommended dosage. This medication should be stored at room temperature and away from light and moisture. Do not share this medication with others. This medication has been prescribed specifically for your current eye condition. Do not use it later for another eye condition unless your doctor instructs you to do so. In that case, a different medication may be necessary. Your doctor may conduct lab and/or medical tests, such as eye exams and measurement of the pressure inside your eyes, while you are using this medication. It's important to attend all medical and lab appointments and consult your doctor for more details. It's important to discuss the benefits, daily dosage, and optimal timing of prednisolone acetate suspension, drops, final dose form, with your doctor to ensure you are using it effectively for your condition. If you happen to forget a dose, simply take it as soon as you remember. However, if it's already close to the time for your next dose, it's best to just skip the missed one and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. Make sure to store prednisolone acetate suspension, drops at room temperature and away from light. Be aware that different brands may have different storage requirements, so check the product package or ask your pharmacist for specific instructions. Do not freeze the medication and keep the bottle upright and tightly closed when not in use to prevent contamination. It's important to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it down the drain unless instructed to do so. Instead, properly discard the medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.